Hello everyone, I am Dr. Vivek Venkat, consultant Uro-Oncologist in Mumbai. A Uro-Oncologist is a surgeon who deals with cancers of the urinary system and the male reproductive organs. I just thought it would be a good idea to describe in brief what these cancers actually are and how they might affect a man. The most common cancer of these is prostate cancer. This affects almost 1 in 8 men during their lifetime. It is one of the most common cancers in the West and it's increasing in incidence even in India. In the early stages, it is extremely curable using a great option called the robotic radical prostatectomy, and in more advanced cases, hormonal therapy and chemotherapy may be needed. It is often asymptomatic and therefore most national agencies and cancer agencies recommend all men above the age of 55 to be screened with a simple blood test called the PSA after the man has discussed the pros and cons of screening with their urologist. The second most common cancers among uro-oncology are kidney cancers. This is the fourth most common in men and the 10th most common among women. Kidney cancers often present with a lump in the flank, which is the region occupied by the kidneys at the back. It may also present with hematuria, which is blood in the urine, or persistent pain and fever. A lot of cancers today are detected incidentally when an ultrasound or a CT scan is done for a completely unrelated reason. Kidney cancers are also extremely curable in their early stage. Today, we remove only the tumor, leaving the rest of the kidney intact, which is known as a partial nephrectomy. This is especially useful in small tumors up to 4 to 5 centimeters, sometimes even up to 7 centimeters depending on the location. In larger tumors, we may need to remove the entire kidney, which is known as a radical nephrectomy. God has given us 2 kidneys and therefore a single kidney is usually enough for a person to live an absolutely normal life. Today, these surgeries are done again using a minimally invasive robotic approach, which allows a more rapid recovery for the patient along with excellent cancer control. The third important cancer in my group is the cancer of the urinary bladder. This too is quite a common cancer and it is seen more in men as compared to women. The risk factors include a very strong association with smoking and also certain industrial exposures, especially among paints, rubber, asbestos, and other such chemical industries. The most common symptom of bladder cancer is the presence of blood in the urine, and therefore it should never be ignored. Blood in the urine is associated with urologic cancers in up to 1 to 10% of cases, depending on other risk factors and the quantity of blood. Therefore, it is one symptom which should always be investigated thoroughly. Bladder cancer is diagnosed usually by an ultrasound or CT scan and then a biopsy, which is known as a transurethral resection, where we put a small endoscope and cut out the tumor and send it for pathology is done. Depending on the stage of the tumor, further treatments, either where we instill chemotherapy or BCG into the bladder or removal of the entire bladder may be needed if the tumor has penetrated deep into the muscle. Bladder cancer can be quite aggressive and therefore strict follow-up is essential. As this is quite a detailed topic, please watch the second part of our video for continuing education.